wherever in the world you are joining us from. I'm going to give it just one more minute before we start, but I think some of you have seen, we've been putting our names in the chat and letting everyone know where you're joining from, as well as if there's other folks joining with you. I'm just going to check one more time. Susie Abedo, are you on the webinar just yet? It doesn't quite look like it yet, but that's totally great.
It's going to come. I think add the names. Oops, sorry.
Yeah.
Yeah, just type the names.
If I could just ask our friends to make sure that we are on mute while others are presenting. We will have time for questions, but if you have anything you'd like to put in the chat, please do. We very much welcome that. Okay, I think I will go ahead and begin. Hi again to everyone. My name is Marissa Straley. I am part of the SWA Secretariat team. I work on country engagement. Many of you who've participated in these webinars know that my colleague Satali typically runs this conversation, but he's in Kathmandu, Nepal for SWA's Asia Regional Consultation Meeting, and he's online, but I do have the absolute pleasure to run our conversation this morning. Before we get into this conversation on sector planning strategies and their implementation, I'd like to take a moment to recognize our new Africa Regional Coordinator. I just realized I should have made absolute certain that Nompi is actually on the line. But Ms. Nompalelo Nanchalinshali, Nompi, please forgive me for the butchering of your name. But we are very pleased to have her join the SWA team. She joined in early September. Nompi, are you on the line? Doesn't seem like she is. Nompi? I do see you. Nompi? Okay, well.
Hello?
Hi, Nompi. Oh, well, sorry. We will give Nompi an opportunity to come back and say hello in just a moment. Nompi, go ahead.
Oh, I'm here now. I'm here.
Great.
Can you hear me? Can you hear me now? Yes. Thank you, Marissa. Hi, everyone. My name is Nompi. I've just joined now. I don't know what was said 2 minutes earlier.
I just welcomed you as the new SWA Africa Regional Coordinator. And if you want to just say a moment about where you joined SWA from.
Oh, okay. Thank you very much, Marissa. This is Nompi from the Kingdom of Eswatini. I've just joined SWA as a regional coordinator from the government constituency. I have many years of working for government and many years of coordinating partners and bringing partners together on behalf of government. I have done it at regional and national level. Thank you very much. I'm happy to be here.
Thanks, Nompi. So to continue on, I'm really looking forward to our conversation today, in which we're going to discuss the newly released 2019 UN Water Global Analysis and Assessment of Sanitation and Drinking Water Report. But I think we all of us really know it as the GLAAS report. And we're also going to hear from SWA partners in the country, external support agency, and research and learning constituencies. And we've asked each of our presenters to speak about what they learned about themselves through the GLAAS process, how they use that information, and then what examples that they can share that the rest of us can learn from. So our presenters today are Betsy Ingebrigtsen from the World Health Organization's GLAAS team, Susie Abedo, she's the GLAAS focal point for the Ministry of Water Resources and Sanitation for Ghana, Oliver Subasinghe, he's Communications and Data Advisor for the Water Office at USAID. And for those of you who may not be aware, the Water Office serves as USAID's lead policy and technical office for water security and sanitation. And last but certainly not least, Lucy Flaws, who's the Global Strategy Analyst at WaterAid. So after after Betsy's presentation, we'll have a bit of time for Q&A, though we're going to limit it just a little bit to make sure that we can hear from all of our presenters, and we'll come back to more Q&A later on in the webinar. We've got set aside about 1 hour, but we'll have another 30 minutes at the end if we need to continue the conversation on. Okay, so one more housekeeping reminder. I'd be grateful if all of you would add your names to the chat, where you're joining from, and if there's anyone else joining with you. If you have any questions that come up or have any issues with the either audio or video, let us know. We'll do our best to take care of that. Okay, so just a little bit of framing for our discussion, and so we'll take a look at the SWA framework. This is really the basis for all of us being here. In order to reach the target set by each of us for SDG 6 by 2030, SWA partners developed a framework to steer all of our efforts. SWA partners are guided by the common values we hold, known as the guiding principles. The building blocks are what is needed to achieve an effective WASH sector, and the collaborative behaviors are the ways in which partners put in place the building blocks. The mutual accountability mechanism puts the elements of the framework in SMART terms. SMART meaning specific, measurable, attainable, relevant, and timely actions. This next slide shows a quote from Ms. Jyoti Shukla at the World Bank, and it emphasizes a point that we really strongly believe in. Countries with the right policies across building blocks have been able to bend the arc of their history. I think in the interest of time, I'm going to just quickly move past maybe these next two slides, the WASH sector building blocks and the collaborative behaviors, and move us to this slide about the comprehensive readiness for the enabling environment for the SDGs. One of the guiding principles that we considered earlier is about evidence-based decision making. This particular slide that we're looking at encapsulates the tools that we can use to capture the advancements, or maybe lack thereof, towards our goal for SDG 6 for each of the building blocks and collaborative behaviors. You see here the GLAAS report is one of those key diagnostic tools that's used. The report was initiated, or the GLAAS report was initiated as the evidence arm of SWA about 10 years ago. By working together, SWA and GLAAS have successfully collaborated to bridge the gap between evidence and policy by making sure decision makers use a strong evidence base to support good decision making. We've worked together to create the collaborative behavior country profiles, and partners have used the data in GLAAS to prepare for the sector ministers meeting, and will more likely than not use it again in preparation for next April's finance ministers meeting. With the most recent cycle, GLAAS is focusing on system strengthening with an infinite emphasis on national policies, plans, and targets. This has happened at an important time as SWA's recently launched mutual accountability mechanism requires that SWA commitments be drawn from the plans, strategies, targets, and milestones that are developed by governments in collaboration with partners within the existing government timeframes. So with that, I am not going to take up any more time and pass it over to my colleague Betsy to take us through the findings of the GLAAS report. Betsy, are you ready?
Yeah, I'm ready.
Okay.
Thanks,
Are you able to advance the slides?
I don't think so. I don't see a button for that.
Okay,
Betsy,
I'm happy to do it.
Betsy, do you see where it says take over as presenter?
No.
No.
Sorry.
So then Marissa would do it for you.
Okay.
Yeah, no problem.
I can just say next. Thanks, Marissa.
Sure.
Perfect. So thank you, everyone, for joining the webinar, and thank you, SWA, for organizing this and giving us an opportunity to talk about the GLAAS report. We're really excited about this cycle, and I think there's going to be lots of interesting things, hopefully, that you will all take away from this presentation. And I wanted to let you know that the GLAAS report is available online, and once I'm done with my presentation, I will put a link in the chat box so you can all have easy access to the report. And if you could go to the next slide, please, Marissa. All right, so first of all, Marissa already did a great job of introducing what GLAAS is, so I can be quick here. GLAAS stands for the UN Water Global Analysis and Assessment of Sanitation and Drinking Water. It is implemented by the World Health Organization on behalf of UN Water, and since 2008, when GLAAS was piloted, it has looked at policy frameworks, institutional arrangements, monitoring systems, human resources, and finance streams in support of sanitation, drinking water, and hygiene. And as Marissa mentioned, and why we're all here today, we recently launched the 5th GLAAS report in August at Stockholm World Water Week. Next slide, please. And so this cycle was really great because we had more countries participate than ever before. We had 115 countries, and we had 29 external support agencies. And the cool thing about GLAAS, I think, is that we look at both what countries are doing in the WASH sector, but also what external support agencies are doing. And so from this map, you can see the 115 countries and 29 external support agencies. Additionally, this is the first time that we specifically targeted high-income countries. Since the SDGs apply to all countries, we thought it was only fair to open up the GLAAS survey, country survey, to 2 high-income countries. And it's cool that we had 2 countries complete GLAAS as both a country and an external support agency, and those are the Netherlands and New Zealand. And then the countries that represented in the GLAAS cycle represent 4.5 billion people and 60% of the world's population. So we had really great coverage, and thanks to everyone on the webinar who played a part in the GLAAS cycle. We couldn't do it without you all. Next slide, please. And so a little bit about how the report is structured. As Marissa mentioned, it's overall looking at national WASH systems with a specific focus on national policies, plans, and targets. We also, though, as traditionally covered in GLAAS, looked at finance, monitoring, and human resources. And our main findings in the report are broken down in 2 sections. We first look at the status of national WASH systems, and then the second, we look at how countries are aligning with the ambitions of the SDGs. And also, as part of that, we look at SDG target 6A on international cooperation and 6B on local participation. WHO through GLAAS is a co-custodian for monitoring those targets, and so those results from that are also featured in the GLAAS report. Next slide, please. All right, so now let's actually dive into the results, which I'm sure what you're all most excited to hear about. You'll see that there's good news related to policies. 94% of countries have policies in place for drinking water, sanitation, and 79% have policies in place for hygiene. But however, just because a policy is in place doesn't necessarily mean that it is fully implemented. And you can see less than 15% of countries reported that they have the funds and human resources needed to implement their plans. So there is a gap between what is on paper and what is able to happen actually on the ground. Next slide, please. And then looking at that in a different way, we call this our policy pyramid. So you can see at the very bottom for sanitation, we have rural in the orange and urban in blue. And it's countries with policies formally approved or under revision or under development. So countries that see the importance of policy and either have it in place or are working on it. And you can see that that is a majority of the 115 countries. We go up a rung and you can see countries with an approved policy. And so there's already a drop off there. And then you look at countries with an approved policy and an approved plan. Because the way we look at it, you have a policy in place, but you also need a plan or a strategy to actually implement that policy. And then the next rung you go up, you see countries with formally approved policy and approved and costed plan. If you have a plan, but you have no idea how much it costs, it's going to be harder to implement the plan. And you can see, though, there's only a small drop. For rural, it's 48 to 44. So really, if countries had plans, they have most likely costed them. But here's where the big drop-off happens, and I think this is a result that everyone should really think about. The countries with a formally approved policy, an approved plan that has been costed, who report sufficient financial and human resources. Only 3 countries out of 115 for rural sanitation reported that, and only 6 for urban sanitation. So you can see there is a stark difference between the countries that have the documents in place and have the actual financial and human resources to support those. And we have found very similar results for drinking water as well. And I should note how we asked the question about sufficient financial and human resources. For this, it was subjective. We asked countries, do you feel you have sufficient financial human resources? And they checked less than 50% of the resources needed, between 50 and 75%, and over 75% of the resources needed. And so we said sufficient was the countries that said over 75% of the resources needed. Next slide, please. And so still looking at policies and plans, but now focusing on leaving no one behind, which I know is a focus of SWA's work and is a key component of the SDGs. So over 2/3 of countries have measures in their policies and plans to reach poor populations. So again, that's a really good sign. Countries understand the need to specifically target poor populations. However, 40% of those countries have corresponding measures for financing these efforts that are consistently applied. So I think you're already probably starting to see the theme that I'm saying over and over again. Things are in place in paper, but they're not necessarily getting the funding and the support they need. And then looking at open defecation, because that is another topic where that affects vulnerable populations and is crucial for leaving no one behind. And so approximately 3/4 of countries with open defecation rates greater than 2%, according to the WHO-UNICEF Joint Monitoring Program, are incorporating measures to address open defecation in policies and plans. So that's another positive finding. And also 63% of countries with open defecation rates greater than 2% have established national targets to eliminate open defecation. And I think that's significant to have targets specifically related to open defecation. Next slide, please. And now this is just zooming in on measures to extend services to poor population. And we broke this analysis down by income group. And you can see that there's sanitation and drinking water. And so if you look in the governance section, that is the column furthest to the left, you can see that policies and plans have specific measures to reach poor populations. And you can look, it's a little bit higher for drinking water, but countries are all in the more or less all in the green. So that is a very positive finding, but then you can see that there's a drastic drop in monitoring and finance. And so we asked if monitoring, do you monitor progress in extending service provision to poor populations, and is that tracked and reported? And again, a lot of the numbers are below 40%. We have a 42 and a 41 in drinking water, but you can see that things are in paper, but they're not necessarily being monitored, and they're also not being funded. And you can see that last column in the finance where the funding is much lower if the measures are actually consistently applied. Next slide, please. And now this slide looks at specifically open defecation. So looking at countries, do they address open defecation in their urban sanitation policies, which is the orange, or in their rural sanitation policies and plans, which is the blue. And we know that not all countries are necessarily affected by open defecation, or open defecation rates vary across countries. So we broke it down into countries with open defecation rates greater than 10%. And those are the top categories. And you can see for those, 78% of countries and 80% of countries have those in policies and plans. So it is a majority, but there are still 20% of countries in urban areas that do not address open defecation, that have open defecation rates greater than 10%. So there is still definitely work to be done. And then, as you would expect, as open defecation rates become lower, fewer countries include them in policies and plans. And next slide, please. And so this analysis, we looked at the WASH targets. And so WASH targets are increasingly reflecting the Sustainable Development Goal ambitions, aiming to provide universal coverage and reach higher levels of service. As we know, SDG 6 is very, very aspirational and will be difficult to achieve. It will be difficult to achieve 100% safely managed access to water and sanitation, but that doesn't mean that we shouldn't try. And countries are definitely taking efforts to align with higher levels of service. And so for drinking water, about half of countries and territories have now set drinking water targets that aim for universal coverage at levels higher than basic services. And we define levels higher than basic is if countries took on board at least one element of safely managed water. And so that would be if they took on board water quality, if it was available on premises or available when needed. And so progress is looking really good in drinking water. In sanitation, things are lagging behind. Fewer than 1/3 of countries explicitly referenced elements of safely managed sanitation in their national sanitation coverage targets. And so there's more work to be done there. You could see that a lot of countries were aiming for universal basic or limited sanitation, but that is still good because incremental progress is still progress, and countries were often had more work to do in sanitation than drinking water and had lower levels of access to sanitation. And there's been a large funding gap between what is needed to reach WASH targets and what is available, just to keep that theme going and hitting that there is a gap between, there is a resource gap. And then next slide, please, Marissa. And so I think this slide is really cool. GLAAS had never done this analysis before. So what does it mean? This cycle, we ask countries to self-report their progress. So WHO UNICEF's Joint Monitoring Program, the JMP, produces internationally comparable estimates. So they get a lot of different sources, do some statistical magic. I don't work for the JMP, so I'm not exactly sure what they do, but they run regressions and then they come out with numbers. And those numbers often don't necessarily match what countries have reported their progress to be. And so we asked countries to give us what their national coverage targets for sanitation and drinking water were, and what was their latest reported coverage data. And so the blue dots are what governments reported as their current level of access. In this slide, it's for urban sanitation. And the orange dots are their targets. And then we calculated the average annual rate of change that would be needed to reach those targets. And this one is for urban sanitation coverage targets for basic and limited services. And then we looked to see what the JMP had done, because they had looked at annual average rates of change. And the greatest annual average rate of change the JMP had ever recorded was 2.9 percentage points per year. So we looked at that as our benchmark of, okay, are countries under 2.9, greater than 2.9? And we found that 16 of 29 countries need to increase coverage by more than 2.9 percentage points to achieve their national urban coverage targets for basic and limited sanitation. So there is a lot of work to be done, but that's not saying it's impossible by any means. I think that this shows this is good information to spark countries to say, wow, we have set ambitions. We need to follow up those ambitions with human resources and with funding. Next slide, please. And so speaking of funding, we found actually quantitatively this year that there is a funding gap of 61% between identified needs and available funds for reaching WASH targets. And this is data from 19 countries and 1 territory. And this is the first time that GLAAS had ever actually collected quantitative data on this. Before, we had asked countries' perceptions on do they have enough funding to meet the national targets, but we never actually asked for numbers before. So we are also think this is a really interesting finding since it's something we'd never done before. And you can see that the funding gap varies between different sectors. For urban sanitation, 74%, rural drinking water, 78%. So there is definitely a funding gap between what is identified needs and what is actually available funding for achieving national WASH targets. And next slide, please, Marissa. And then, so this, I didn't present many finance findings from the GLAAS report because I know the most recent SWA webinar earlier a few months ago focused on finance. And since the GLAAS report focused on systems, I thought I would share a little bit of information on financial systems rather than actual quantitative information on financing, but there are 2 chapters on financing in the GLAAS report. So there's much more information available if this piques your interest. And so we found that national financial systems for WASH are insufficient. While most countries have financing plans for WASH, more than half of these plans are insufficiently used in decision making, and detailed reporting on WASH financial data is also rare. And so if you're not able to track what you're spending or know what your budgets are, it's difficult to successfully implement the plans and policies that you have in place. And so we found only 22% of countries and territories could provide disaggregated WASH budget data for drinking water and sanitation. And we also understand, though, that WASH is a complicated sector. You don't necessarily just go to one ministry and get all of your information. It is spread across ministries and different departments and I'm sure different ministries and different departments have different reporting systems, but still only 22% of countries could give us disaggregated WASH budget data. And also, fewer than half of countries reported the use of performance indicators on expenditure and cost effectiveness. And I think this speaks to the importance of monitoring, and what you count is what matters often in things. And so if you're not looking at performance indicators on expenditure and cost effectiveness, you're not necessarily able to make the case for more funding or better use of the funding that you have available. Next slide, please, Marissa. And now, since GLAAS looks at not only what countries are doing, but also what donors and development partners are doing, I wanted to share one slide on results focused on them. And this is a slide focused on aid. And so in the box, first of all, you can see ODA commitments from 2015 and 2017. And so total ODA, that means all official development assistance in the world. So going from all sorts of topics. And you can see that the overall amount of aid, official development assistance, is going down. But water and sanitation ODA went up by 19.2 percentage points. So that's pretty good news for our sector, is that while overall aid is falling, aid for WASH is increasing. And then if you look at the graph above, the orange line are commitments. So what have donors pledged to give? And the blue dots are disbursements. So what was actually released by the donors, because there is often or always a lag between commitments and disbursements. And so you can see disbursements have somewhat fallen off, but commitments are on the rise. If you look at the orange spike at the end near 2016 and 2017. So we hope to see more we hope to see greater WASH disbursements in the next few years as those commitments come into play. And then next slide, please. And then finally, so those were the highlights I wanted to share from the GLAAS report. And as I mentioned, there's much, much more in the GLAAS report. I encourage you all to look at it. And we really do this for the sector, for countries and development partners to use. And so we also have a number of other resources available. First of all of the data from the report is available online. It is included in data annex tables in the report, but it's hard to analyze data from a PDF. And so we put all of the data from the report in Excel sheets And those are currently available online for you to do your own analysis. In the coming months, we'll put on the entire GLAAS 2018-2019 data set. The GLAAS survey covers a huge amount of information, and we are not able to put it all in the report, but all of the information that we collected will be available online. As Marissa mentioned, we're also preparing GLAAS country highlights. Those of you who worked on GLAAS in country, we will soon be sending them to you for validation and final approval, and that will be done on a rolling basis. And once they are validated by countries, they will then be put online, and so they'll be publicly available. And we also produce GLAAS external support agency highlights. And so for all of the donors and NGOs who also completed the external support agency survey, we prepare highlights for them. And they are also validated with the external support agency and available online. So I encourage you all to also look at the data and the highlights that we make in addition to the GLAAS report. And Marissa, that's my thank you all for listening. If you could just put the last slide up. And I'm happy to answer any questions. Thank you all.
Thank you so much, Betsy. Really, really appreciate that presentation. There's a lot of really interesting information in there, so I'm hoping that we have some good questions for you. So questions, please feel free to unmute yourself and let us know that you'd like to say something, or type in the chat box and we'd be happy to share that question.
Hello. Hello.
Hi, yes. I think
Hi.
there's two people wanting to speak at the same time.
Yeah. Oh, I see.
Go. Is that Nick Igwe?
Nicholas. Yeah, that's correct.
Hi, go ahead.
Thank you. Thanks so much for the wonderful presentation. My question goes to the last presenter, to Betsy. Now, how do you measure the impacts of your reports, all these reports, 2019, what the previous, reports? How do you measure the impacts on the achievement of SDG 6 in different countries? Even if you take a case study of one or two countries that you know that really use your report for proper implementation, either for budgeting or for whatever it is, for creating more funds. How do you measure that? How do you monitor? How do you evaluate the impact of your report in achievement of the SDGs?
Thank you, Nicholas. Betsy, if you can maybe keep that one in your mind, and I'm just going to ask the other gentleman that wanted to speak. If you want to go ahead and ask your question, we'll have Betsy address them.
Yes. Hello.
Sure, go ahead. Yep, please go ahead.
All right, I'm Timothy. We're from Liberia.
Hi.
And first, I want to say thanks for the presentations. It's very much interesting. But I'm a little bit concerned whether within the reports, are there recommendations for improvements, in terms of overcoming those gaps per country? Is there any room for that? And then will you please share this presentation with us so that at country level we can digest the report as well?
Thanks, Timothy. Betsy, do you want to go ahead and address those two, and then we'll see if there's some more?
Yeah, and I also see one in the chat box that I can address too. So first of all, measuring impact of our report, that is a great question, and I think something that we think about all of the time. I know it's really difficult to write a global report and then see how that is translated into action. And so I think there's a few ways we do it. Specifically, we collect data on SDG target 6A and 6B, and that is used to report to the UN Statistical Division. And so that is the official reporting on SDG 6A and B. And so you can see progress there, but that's more of global or regional. And then how do we see country impact at country level? The impact of the report at country level, that is really, I would say, anecdotal. We're in close communication with a number of our partners and at different conferences and meetings and presentations, we'll hear how they've used the GLAAS report. We also, along with the survey, have a country feedback form where we ask countries to discuss the impact of the GLAAS report and how they are using the GLAAS process. And in the annex of this report, in one of the annexes, we highlighted some of those examples. So it's not a rigorous monitoring system where we can see the impact of the report, but we do see some of it. I also think looking at the SWA high-level meetings and the SWA mutual accountability mechanism and things that SWA is doing also gives us an opportunity to see the impact of the GLAAS report. Regarding recommendations for improvement by country, WHO as a global organization and GLAAS as a global monitoring initiative, our role is to provide the evidence. And I know I'm sure that is a very unsatisfactory answer, but we put the evidence out there, and then we hope that governments and NGOs and civil society and development partners use the information that we put out there to then have workshops or meetings or other sorts of things or advocacy campaigns to make the changes, but we don't have the capacity and are in the position to provide global or country-specific recommendations. But I encourage you to look at the report. Within the data annex tables, you can see how countries compare amongst other countries in the region or globally. We'll also put out the country highlights, which put the data in a way that countries are able to adapt and use in their own efforts. Regarding sharing of the presentation, yes, I'm sure that we can share that with you, and I will liaise with Marissa about how best to do that. And then in the chat box, I saw there's a question on, is there data specifically on WASH and healthcare facilities? And is there specific WASH and healthcare facilities budget data? Yes to both of those questions. In the report, we have a highlight on WASH and healthcare facilities where we present some of the data. I think there might be some of that data online in the Excel sheet, but all of the WASH and healthcare facilities data will be included when the full data set comes online. And I just looked at the country survey, and we do ask, as part of the disaggregation on WASH budget data, we do ask for WASH and healthcare facilities. However, I want to reiterate that only 22% of countries were able to provide disaggregated data. So just because we asked for it, I'm not sure how much data will actually be there. Over to you, Marissa. Or I also see there's more questions in the chat, but I don't know if we want to keep going.
Yeah, let's do a couple minutes, and if anybody else wants to ask a question, please feel free to unmute their mic, and we'll take that too.
Yeah, sorry. Thanks so much, Nick again. Yeah, you tried a lot to answer the question, but now is it possible for you to organize a very special webinar where either government focal points or decision makers will really, come together, not really SWA members as such, talking about government, focal points that really need to implement these, reports, to look at the changes and how the report is really, helping them. If they have any challenges, do they really understand that? Do they really understand why the reports are there and the impact it will make in terms, for them? So have you attempted to have any kind of webinar or any kind of, bringing these reports together, maybe 115, countries or, less than that, or doing them, regionally? Is this something that you're considering doing, so that you feel that you spend so much time and resources to put this report together, that the report is getting the attention it's supposed to get to the right quarters or right, places? Yeah.
Mm-hmm. No, thank you for that question. I think it's varied by region because WHO is also very much a regional organization. So our colleagues in the European region have done some individual workshops and are brainstorming on what to do. I will take the webinar idea back to our team. We honestly had just finished publishing the report and have thought about some of the some of the ways to publicize the information, but hadn't done anything as systematic like that. And I also know, for example, other organizations have taken information from GLAAS and then implemented country-level workshops. So there's a USAID Resilient Waters program that is based in Southern Africa, and they, through that project, they had gap analysis workshops in a number of different Southern African countries, looking at the country's GLAAS survey response and then using that information. So there is information. I think this is a really good idea that we could do it more systematically across all countries. And the GLAAS team is actually having a bunch of meetings next week, so I will raise your point there. And then, Marissa, do you want me to look in the chat and answer a few more of these?
Actually, if you could go ahead and, yeah, I want to move on because we're getting close on time. If you could address them in the chat, that'd be great. Or if there's any sort of offline conversations, maybe you could invite somebody to do that as well. Let me just double check to see if Susie Abedo is online. Susie is, she explained to me that she was traveling and she was unsure of the internet connection she was going to have. So Susie, are you online? Okay, so seeing as how she's not, she recorded her presentation in advance. And so I am going to now try and share that with everybody. Let's see. Okay, so you all should be seeing my screen, I believe. Can you just chime in and let me know if that's the case?
It's loading.
It's loading, okay.
So Marissa, it seems to have loaded, but we can't see anything. And I'm not sure whether you can hear her from your side.
Yeah, let's see. Yeah, okay. Let's see. I can start playing and see if people can hear the audio at least.
Yes. So it's showing now.
Okay. Okay, great.
We can't get the audio, Marissa.
You can't get the audio?
No.
Okay, now we can hear, we can see it.
We can see, but we cannot hear. So
Yeah, we see it, but we are not hearing it.
Marissa, I think we the system cannot pick the audio, so perhaps we should just skip it and then we can send it later to people.
Yep, happy to do that. We'll post the recording, the full presentation, and post the recording on our website and email it to everybody. I'm sorry that didn't work. We don't want to waste too much time on it, but it's a really interesting presentation, and actually shares some feedback from the Ghana team, specifically to the GLAAS team. So it has some really interesting takeaways. So I'm going to go back to this. And if you all would just give me a moment, I'll load the PowerPoint back up.
And Marissa, maybe while you're doing that, just to add on to the question that Nick had posed, regarding regional focused webinars. So partly these webinars that we've organized around the report and its focus on sector strengthening, these webinars are also done or somehow on a regional basis. We just had one for Francophone, for the Francophone countries the day before yesterday, and today we're focusing mostly on Africa. And then tomorrow we are in fact having a discussion with people that are attending the Asia regional consultation. So we're actually doing it on a regional basis as well, just to reinforce some of the avenues through which GLAAS will get the information out. Thank you.
Thanks, Tatali. Okay, so moving on. Oliver, are you online? You ready to take over? Oliver, you might be muted. Oh. Oliver just sent me a message that, Oliver, are you there? If I can just check, others are able to see the slides, right?
Yes.
Okay, all right. Then we'll wait for Oliver to come back online. He just sent me a note that said he dropped off. Lucy, are you ready to take over?
Hiya. Yeah, I can take over instead.
All right.
Yeah.
Thanks. And then we'll come back to Oliver when he comes back online. Thanks.
Having said that, actually, I haven't got the functionality for the takeover as presenter. It's disappeared from my screen as well. I think Betsy was having a problem with that too. So if I can just say next and you can move to the next slide, that would be great.
Yes, absolutely. Yeah, no problem at all.
Super. So hello, everybody. Oh, Oliver's just sent a message. Oliver, are you happy for me to continue or do you want to take over? Okay, I'll go ahead. Great. Okay, so hello everybody. I'm Lucy Flores. I'm the Global Strategy Analyst for the WaterAid International Secretariat, and I've been asked to speak for a few moments on the work that we do with regard to GLAAS as I coordinate the submission for the GLAAS for the WaterAid Federation. If you could just pop to the next slide, please, Marissa. Great. So we were just discussing why it's important to participate. For us, partnership and effective collaboration is really at the heart of our global strategy. We collaborate with and where appropriate provide support and resources to many different types of partner organizations from civil society, private sector and government. And WaterAid believes that the building blocks that form a key part of the SWA framework are critical to a well-functioning sustainable wash surfaces, and the SWA collaborative behaviours are also, a key pillar of the SWA partnership. Such GLAAS is an important tool as they track the sector progress around the building blocks and the collaborative behaviours. So for us, in order for SWA partnership to be successful and for us to achieve SDG 6 collectively, it's very important for us to report on progress so that we know how well we're doing. We can hold each other accountable so that we can see monitoring of the performance of SWA partners as a key sort of stepping stone really to building and sustaining partnerships needed so that we leave no one behind. And WaterAid was a central player in the development and adoption of the SWA collaborative behaviours and inputs into the GLAAS survey and the GLAAS survey development, and we remain committed to ensuring that the SWA behaviours are operationalised both within WaterAid and across the sector. So really for us, the GLAAS survey is absolutely key to reinforce that work, and certainly the quote that you used from Jyoti Shukla, I think earlier, Marissa really summed that up nicely as well. Next slide, please. So my lovely graphic here just shows the different ways that as WaterAid we use the information that comes out of the GLAAS survey. Obviously for us the priority is tracking and reviewing the strength of the WASH system at the national level. So we summarise the highlights from each chapter of the report and share that internally and with our partners, and analyse progress and issues for our WaterAid sort of country programmes, the programme country specifically. Overall, I suppose we use it a lot to reinforce our work and really use it as sort of evidence of our work. So the report reiterates much of what we already know. For example, policies exist, but often aren't implemented. Plans exist, but they don't necessarily have the required finance or human resource. And similarly, monitoring processes exist, as Betsy was alluding to, but data isn't collected frequently. So there's a lot of common themes there, and that's very useful to our work to reinforce our messages from a policy perspective. But there's also a lot of areas of divergence that really highlight the differences between the countries where we work as well, which is really useful for us. The findings also re-emphasise many of our existing policy positions, the need for political will to drive the implementation of plans, the need for more and better finance, and the need to strengthen the governance functions that are required to deliver sustainable services. It's also useful for us to support our sort of global element, the global component to these national level processes. It allows us to pull together a global picture of how well we're doing, and also helps to identify what course corrections might be needed at that global level as well. And lastly, it's also useful for us for our internal reflection and our internal tracking. So it's shared across our organisation to promote the work that we do, to give recognition to country programmes achievements. Its data is also used, just as a specific example, for our ongoing analysis work at country programme level, such as strategy development work. So I know there's a couple of countries at the moment using the GLAAS country level data to help with their context analysis for their strategy and strategic approaches. Okay, next slide, please. Thanks. And so this is where we were just considering what did we learn about ourselves. And as I've already sort of spoken about, for us, it really reinforces a lot of the things that we already know. But it highlights many of the ways in which WaterAid is successfully delivering our aim to support governments and service providers to strengthen systems and capabilities required to deliver sustainable water sanitation and hygiene. For example, of 60 country programmes for which WaterAid provided data in the last GLAAS survey, we're supporting recipient country governments in the development or implementation of decentralised multi-stakeholder planning processes to a moderate or high level in nearly all of those cases. And we can see that that's because of our district-wide approach that we use to strengthen our monitoring, planning and financing and service delivery, that we use for our post-implementation support and asset management functions. So we can really see that the work that we're doing is getting to the heart of the GLAAS survey and the progress that's being made. But for us also, GLAAS highlights that one of the things we find difficult is tracking and reporting our progress. So having said at the start of this presentation how important the SWA collaborative behaviours are, we find that, despite this commitment that we've got to system strengthening and the collaborative behaviours, for us, the GLAAS survey really shows that we don't have information on, or our internal record keeping does not align with the metrics tracked through GLAAS. So we've still got a lot of work to do there, and I'll speak about that a little bit more in the next slide. It's also useful, as I've just alluded to for internal reflection and tracking, and some of the information that we collected through GLAAS sort of brought out things that we don't otherwise collect on. So I've just put a specific example at the bottom here around question 6.3. We don't collect this as a matter of course, but I was able to reach out to a lot of our country programmes who were able to send us information about how we leverage our funding to increase national to advocate for increases in national budget, and we saw some really good achievements there in countries like Pakistan and Zambia and Ghana and Mozambique, and the governments there are increasing their budgets for WASH. So was a great achievement that we were really pleased to be a part of. Just on to the next slide, please. Yeah, so as I was just talking about in the previous slide about what the GLAAS survey shows us, and what it's also taught us about what we don't know about ourselves, is really this fact that we don't necessarily collate all of the information that we should, that we can have at the sort of touch of a button to report against the SWA collaborative behaviours. And we see this as a big issue because it stops us pulling together a complete picture of how we're working with partners in countries to deliver sustainable, inclusive WASH, and it makes it harder for us to learn and adapt and improve the way we operationalise the collaborative behaviours. So our Chief Executive of WaterAid UK, Tim Wainwright, made this commitment, as I've just sort of highlighted in this pink box, to really improve the way we report on the GLAAS indicators for mutual accountability, for government leadership, and strengthening country systems across our country programmes. He announced this at the sector ministers meeting in Costa Rica back in April, and as a commitment to the gaps that we've sort of already talked about. And we believe that filling these data gaps is really important internally, so we can understand the ways we are or are not supporting national planning and delivery systems. We saw making this commitment as part of our commitment to try and evolve in this area and live our commitment to the SWA collaborative behaviours and the broader system strengthening agenda in our governance process and the way we measure our work. But we're also hoping that this commitment will have a broader value, and that's one of the reasons that I wanted to bring it here for discussion as well, is in making it, we hope that it fosters greater mutual accountability across the sector for the ways in which we're working together to deliver lasting wash and sanitation services. WaterAid is certainly not alone in having some of these gaps at present. So we're hoping by making this commitment, it will really encourage other people and other organisations and partnerships to think about their gaps and to make those incremental steps in collecting the data every year. And that's really it from me. I think I've gone over my time a little bit, but hopefully that was useful just to give an idea of the work that we're doing and the changes that we'll be planning to make over next year. Thank you.
That was terrific, Lucy. Thank you. Are there any questions for Lucy? Nope. Okay. All right. Well, thank you again, Lucy.
Thanks very much.
Going to backtrack the slides. Oliver, are you online?
Yes. Can you guys hear me?
Yeah, that's great. Yep, please go ahead.
Sure, great. Thanks, Marissa and Satali, and thank you, Betsy and Lucy, for the great presentations on GLAAS and how it's applied. As Marissa mentioned, I'm Oliver Suvasinga. I'm a communications and data advisor in USAID's Water Office in Washington, D.C. I'm also, like Lucy, for our external support agency, I'm the coordinator for our submission to the GLAAS report. So I'll just take a few moments to discuss a little bit about why USAID feels it's important to participate in the GLAAS report, but also how we're using the information and the rich data that comes out of it, and to that question earlier about what kind of impact is the GLAAS data having. So I'll just start off quickly in terms of, as our perspective as a external support agency. The GLAAS survey really allows us to have a more informed and open dialogue with our partner countries about the levels of investment and the enabling environments around WASH services. It also helps us understand our partner countries' priorities in the sector and how we can best align with those priorities. And it also very much complements the great work that our colleagues at UNICEF WHO's JMP does around global access and monitoring data. So it kind of helps round out the picture in terms of the context to what inputs are going into the sector. And then JMP, of course, is what access rates and coverage is doing on the other side. So, at USAID, we view water and sanitation as a system that needs strong governance, professional service providers and needs to attract both public and private investors. So GLAAS provides us with a much better understanding of a country's governance and finance context that lays the foundation for WASH access. And we're also very excited to see more countries participate in the ESA survey and the richer data, especially on budgets and expenditure that's coming out of GLAAS as well, even though it may, as Betsy's presentation before, it shows more red than green, unfortunately, but it's a great start to be able to have a dialogue and move financing forward, just basically having the basic understanding and baseline of what's going on with budgets and expenditure in the sector. So as a donor, in terms of introspective reflection on our own GLAAS report submission, it allows us to, I think, two things. One is kind of reflect upon how we're aligned with our partner countries and other donors in terms of our objectives and goals. I think another important aspect of it is we have a very similar challenge that my colleague from WaterAid, Lucy, mentioned in terms of internal reporting. So as a donor agency, for example, we have about 250 performance indicators across all sectors that USAID uses to monitor its progress in our foreign assistance. And that's across agriculture, economic growth, women's empowerment, and WASH, and many, many other sectors. So sometimes being able to add indicators can be a bit daunting and be a very difficult process. So in terms of kind of where we're going in terms of some of the collaborative behaviors, so for example, this go around with GLAAS, we had like a mini internal survey that we used to gather the information we needed on which missions, which are our country missions, were kind of their programming was reflecting the collaborative behaviors. And so that's in terms of inputs. In terms of sort of outputs, we did add 2 indicators this year for foreign assistance, performance indicators that cover strengthening governance in the sector and also mobilizing new financing. So they are, output indicators, but I think it kind of makes a good complement to the other performance indicators we look at, like number of people gaining access, and I think kind of broadens the view of what it takes to actually get there to improve access. So a little bit about how the agency is how we're currently using the GLAAS data. There's kind of 2 main ways that we use GLAAS. One is at the global level, and then the other is at the country level. So first, at the global level, we use the GLAAS data to assess partner countries' commitment and capacity in the sector. And specifically, it's for how we designate what we call high priority countries for water and sanitation assistance. So we have our North Star as an agency for our work is the Water for the World Act, which was passed by our Congress in 2016. So the Water for the World Act basically focuses on a goal of the U.S. government demonstrating leadership in advancing safe water and sanitation for the neediest and most vulnerable, and especially a focus on first-time access. And we're the lead agency for that goal in the foreign assistance space. So with that, the Act requires us on an annual basis to designate high priority countries that are the primary recipients of our foreign assistance. And to do that, there's kind of 2 big buckets of criteria that we need to look at when assessing countries. It's actually written into the Water for the World Act. The first is analyzing a country's water, sanitation, and hygiene needs. And the main tool we use for that is the great data that the JMP team produces. And then on the opportunities side, we use GLAAS as kind of the core in terms of looking at where there is commitment, capacity, or where there's gaps in commitment and capacity, and where we can best work with our partner countries to fill those gaps. And again, so this is to demonstrate, we use the GLAAS data to demonstrate and show a proof point of why partner countries are committed to the sector. And it provides, a very valuable third-party source of data on the sector and on countries in terms of governance, on monitoring and HR and financing, so that we can make the most informed and objective recommendations to our senior leadership on designating countries as high priority. So that's the first way. In the second way, and this is what we like to see the most, is the use of GLAAS at the country and regional level to identify gaps, define common goals, and reinforce the mutual accountability principles that are a part of SWA. So I think Betsy mentioned this a little bit earlier. There's a great example in the GLAAS report. This go around of our program called Resilient Waters, which is a regional program run out of Johannesburg, and our mission there Pretoria for our mission there. And it's a regional program that covers Southern Africa. So as all the folks on this webinar may know, despite much progress that the Southern Africa region has made in terms of universal coverage, there's still many challenges, especially when it comes to sanitation access in the region. So our colleagues in Southern Africa use the GLAAS data as an objective way to basically start a dialogue, start a conversation with our partner countries, and looking at how we can design our foreign assistance to best meet their gaps and needs and goals in the country. So the way this was done was through a series of workshops that were held over this last year, and they were in Botswana, Mozambique, Namibia, South Africa, and Zimbabwe. So all very different country contexts. And based on the GLAAS survey, it helped inform what we would potentially do in terms of our programs in those countries, and also align those with national objectives. And a great example of that specifically was in Botswana. We used the highlight issues around sanitation coverage, which is lagging behind drinking water supply in terms of progress in Botswana. And the government has been very responsive in looking at developing a sanitation roadmap that will kind of guide where all the players in the sector and all the ESAs and folks like us will basically best provide and fit our assistance. And that's, I think, still in the works. It was about 6 months after the workshop it was going to be developed and finalized, I believe. So those are, in general, kind of the two big ways that we are using the data and how it's having an impact both on our policy and our programs.
Thanks, Oliver. Really appreciate that presentation. Okay, any questions for Oliver? You can unmute your mic. You can post a question in the chat. It actually doesn't have to be a question just for Oliver. It could be really for any of our presenters right now. If you want to bring something back up to the floor, certainly give you that opportunity. No? All right. Okay, well, thanks, Oliver. I'm going to skip back ahead. I recognize that we are a few minutes past the hour. Yes, okay, so we should have a slide in front of you that says, how will you take this forward? We are keen to understand from our partners when the next opportunity would be to discuss the GLAAS results and how they pertain and as they pertain to you. What's the key action, it should be you need to do given the results of the GLAAS report? And then considering the mutual accountability mechanism process, do you foresee an opportunity to strengthen existing commitments or table new ones? Now, I know we have a lot of country partners, definitely many civil society organizations, private sector, governments, external support agencies, research and learning institutions. We have all of our constituencies covered in this conversation. So be really keen to hear from some of you. It doesn't necessarily have to be answers to all these questions, but if there's any question that you might like to answer and just share how you'll be able to use the GLAAS information and to take it forward to discuss some of those things like our other presenters did. Any takers? You are welcome to take the floor. to unmute yourselves or to type in the chat box. Now, I know we have colleagues from Liberia, CSOs. Let's see, I know we have many colleagues from Nigeria, Chad. I see Rabab from Egypt. Any of you willing to share with us some thoughts on any of these questions? I'm sure you're speaking, so I'm sure you're just on mute and would be happy to unmute yourselves, right? No? Okay, well, we have a very quiet, yeah?
Yes, again, Timothy, we're from Liberia. Number, I think we are happy to form part of this process, and I was a little bit like looking to see whether any representative from the government was part of this meeting. But I wrote in the chat room talking about whether is there any opportunity for USAID to work with Liberia in terms of data management, because that is one of the key things that we really lacking of. The system in terms of data management is totally lacking. So we just have the ministry, WASH Commission just established, and those kind of assistance will actually be good for our country. So just thinking whether is there any opportunity in that direction.
Thanks, Timothy. So a couple, maybe a month ago or so now, maybe almost 2 months ago, SWA was able to bring together a number of partners who are focused on management information systems. And what I'd like to do, I'm not sure if you were part of that conversation or not, but I'd be happy to follow up with you offline and to share some of the resources that were discussed during that conversation, and to help connect you with some partners, maybe some country partners who you could discuss their experiences with, and maybe learn about some of the opportunities, but maybe also challenges that they were dealing with as well. So happy to follow up with you offline on that for sure.
Okay, thank you.
Oh, Marissa, could I just follow up on that as well?
Sure. Yeah, please go ahead.
Yeah. Thanks for your question. And as Marissa mentioned, so that workshop that was done along with SWA was also USAID participated in and supported it. So I'd be happy to put you in contact with some of the folks on our side that also were involved in it as well. So I think a lot of it was helping train, I believe, the WASH Commission members on how they can better use management information systems, but also there was some capacity building around data science and how you can use data science to monitor, but also look at predicting, potential failures in systems or what are like proxy or leading indicators. So I'd be happy to also send you those contacts along as well.
Thanks, Oliver. Okay, back to our questions. When's the next opportunity you would have to discuss the GLAAS results as they pertain to you? What are the key actions you might need to do given some of the results of the GLAAS report? And considering the mutual accountability mechanism, are there opportunities to strengthen existing commitments or potentially table new ones? Any takers on those questions? Man, you're a quiet crowd today. Maybe it's that Satali isn't leading the webinar that people aren't chiming in as much as they normally do. Well, I'm not going to force any conversation here, but just to say that maybe these are some questions that you can consider with your partners and see how you might be able to put into action some of the findings of the GLAAS report. I think there were a couple questions maybe in the chat, Oliver, for you, if you want to quickly. One was about, is USAID supporting programs around WASH in Gambia? And then you just mentioned that Liberia is a high priority country for USAID.
Yeah, just to follow up on that, I think in terms of how we apply the GLAAS data. So for example, Liberia was designated as a high priority country, and some of the kind of justifications for that, arise based on, what we learned through the GLAAS report. To Joe's comment, hi Joe. So right now, Gambia is, I don't believe that we have any active programs in Gambia. So just kind of to give the categories of assistance. So we do have high priority countries for water and sanitation assistance, like Liberia, but those are not the only countries that we provide WASH assistance in. There are also countries that we use a term called strategy aligned, where it's also there's active like water and sanitation programming. But it's a little bit less than what you would see in like a Liberia or a Kenya or some of our other high priority countries. We are, as an agency, have a regional presence in West Africa and in many other West African countries. So I can follow up with you, Joe, to double check if we do have anything active there right now.
Okay, thanks, Oliver.
Sure.
All right, one last call. Any comments, further comments, questions? Okay. Well, with that, yes.
So I was just thinking that I think maybe one thing to just encourage colleagues is that towards the end of the report, there's several tables in the GLAAS report where information by countries can be found. And so if say there's a sector coordination meeting or whatever conversation might be happening at country level, it might be worth trying to see, trying to maybe have a conversation on the agenda in terms of the results of this, the GLAAS survey, just in terms of looking at, say, some next actions for using the report. I think Bessie did talk about the GLAAS profiles as well, and I think once those are out, that would be a really good opportunity to also discuss further. From the Secretariat's point of view, we will be working on the second collaborative behaviors country profiles, which draw on they use a lot of information from the GLAAS results. So once these profiles are out, it will also be a good opportunity to practically have a discussion in terms of what the current status is regards the collaborative behaviors, but also figuring out what might need to be done going forward. And we anticipate that we possibly will have these profiles towards the end of the year. We are hoping to have that by the time we start the discussions for the finance ministers meeting, but if not, at least by the end of the year. And that's another good opportunity to look further at how these results that we're seeing today or can lead to further dialogue at country level. Thank you.
Thanks so much, Sally. Okay, I just put a link in the chat of the webinar. This link, by the end of the day, will have the presentation uploaded to it, and it'll also include the video recording of Susie's presentation. Again, I'm really sorry that we weren't able to make that work, but I would really encourage you to go listen to that presentation, or at least flip through her slides. It's really interesting and useful, and that country perspective is country government perspective is most important. Betsy, I really encourage the GLAAS team to consider some of the things that Susie's suggesting there as well. Okay, so thank you so much to our presenters, to Betsy, to Lucy, and to Oliver, and to Susie. And thanks to all of you for joining us for this conversation. We really appreciate it. We'll have another webinar coming late October, and I'm sure we'll be talking to so many of you in the meantime. So thank you. Have a great rest of your day, evening, and we'll talk to you guys soon. Take care.
Thanks, Marissa.
Thank you.
Bye. Thanks, everyone.
Bye. Thanks.
Thanks.
Bye. Thank you.